pelvic muscles and muscles of lower extremity. This is today's theme. So let's begin from the muscles of gluteal region. Now, most famous muscle, musculus gluteus maximus. You can see the direction of its fibers, which is obliquous. And another muscle, number 2, gluteus medius, with direction of fibers vertically oriented. And also it's good seeing that musculus gluteus medius is covered by fascia. So that's why it isn't so clear seen as gluteus maximus, because here this facial sheet was removed. Then number 3, it's musculus semitendinosus. Number 4, musculus biceps femoris. Then number 5 is musculus adductor magnus, and number 6 is musculus gracilis. It's very important what kind of muscles of posterior surface of thigh we can see here. So number 5, adductor magnus, is the muscle which could be seen both from anterior surface of thigh and from posterior surface. So it means that in our cadaver, in posterior surface, we could find this number 5, musculus adductor magnus, and also we could find it on the anterior surface. And now number 7. Number 7, here it is, most laterally oriented. It's musculus vastus lateralis. It's also interesting because vastus lateralis is one of the heads of musculus quadriceps femoris, and it belongs, musculus quadriceps femoris, to the anterior group. But now we are watching from posterior surface. So vastus lateralis could be seen both from anterior and from posterior surfaces. It's very important. And now more deeply arranged muscles. First of all, number 2, we can distinguish. It's musculus gluteus medius. Gluteus maximus was cutted and removed, and that's why we can see another muscles. So gluteus medius also was cutted, and this part was removed. And under it, more deeply, we can find another muscle. Number 8, what is it? It's musculus gluteus minimus. It's very interesting to compare musculus gluteus maximus, number 1, the direction of fibers, and musculi gluteus medius and minimus. Medius and minimus practically identical according to direction of the fibers. So they are parallel to each other, and only one difference. Gluteus medius is located more superficially, and gluteus minimus, number 8, more deeply. Because of such kind of direction of fibers, they can fulfill different functions. First of all, abduction, but also rotation into the interior and exterior directions. Then another very interesting muscle, number 9. What is it? It's musculus piriformis. What does it mean, piriformis? It means that this muscle has a shape of pear. You know these fruits, an apple and a pear. So like a pear according to shape. For me personally, it's difficult to find any resemblance with this fruit pear, but nevertheless its official name, piriform muscle. So we can see that it was originated from anterior surface of the sacrum, and here the place of attachment in the region of Trochantermeier. So here, like a fan, several muscles gather it together and attach practically in the same point. That's why practically each of them can rotate the thigh laterally. So it's named supination. And musculus piriformis is very important according to these small gapes or openings. According to musculus piriformis, they called as foramen suprapiriformis, this one, and foramen infrapiriformis, this one. And there are a lot of important vessels and nerves which are pass here through these foramina, and most famous nervus ischiadicus, which passes through foramen infrapiriformis here. Then this muscle. What is this? It's foramen obturatorium, and now we can't see foramen obturatorium because it's closed by this muscle. Number 10. What is it? It's musculus obturatorius internus. Why internus? Because we are watching here to the os pubis from the region of pelvis minor. So from interior surface. That's why it's musculus obturatorius internus. From exterior surface, we can find musculus obturatorius externus, but now we are watching from interior surface. Here it is small tendon of it, which also attaches in the region of Trochantermeier, and close to it we can find two another muscles, one of it number 11 and another 11 with a point. What they are? Musculi gemelli, superior and inferior. Gemellus superior and gemellus inferior. Like brothers. That's why such name, gemelli. And for us it's important to remember that musculi gemelli, in plural, they are located from both sides of tendon of musculus obturatorius internus, from superior and inferior sides. So these three tendons are arranged together: gemellus superior, obturatorius internus, and gemellus inferior. And lower, what we can find lower, number 12, it's musculus quadratus femoris. Musculus quadratus femoris. Now, in comparison with musculus piriformis, it's really looks like a square quadrate shape. So, musculus quadratus femoris is last muscle in this scheme. And now let's try to watch this region from lateral aspect. Here it is, muscle of lateral surface of the thigh. And again, musculus gluteus maximus, here it is. Then musculus gluteus medius, here it is. Now the fascia was cut and removed from both these muscles, from gluteus maximus and gluteus medius. And direction of fibers is good seen, oblique direction in gluteus maximus and vertical direction in gluteus medius. Then number 3, what is it? You can say that it's a tendon. It looks like tendon, but we can say that it's thickened part of fascia lata. Fascia lata, like a scarpet, surrounds the thigh from all sides, but previously we cut it and removed this sheet of fascia lata from anterior and posterior surfaces, and only here laterally, this most thickened part of fascia lata, we can see it called as tractus iliotibialis. Why? Because it originates from os ilium and attaches in the os tibia. Tractus iliotibialis. We can say that it is thickened part of fascia lata. Fascia lata is fascia which surrounds from all sides the thigh. And also we can say that tractus iliotibialis fulfills the function of tendon for muscle number 4. What is it? It's musculus tensor fasciae latae. Tensor fasciae latae. So its function is really could be seen in the name, to make a tangent to fascia lata, and also it could move the leg. Then number 5, what is it? We already discussed this muscle. We said that we can find it not only from posterior but also from anterior aspect. This is musculus vastus lateralis, one of the head of musculus quadriceps femoris. Musculus vastus lateralis. Then number 6. What is it? Number 6. It's musculus biceps femoris. Biceps femoris had 2 heads, long head, caput longum, and short head, caput brevis, and they together attached in united tendon, and we can always see it from lateral aspect, also from posterior aspect, but from lateral always. So, musculus biceps femoris, caput longum, and caput breve. Then, number 7, musculus semitendinosus. Semitendinosus. We try to designate each muscle which we can see here. So it's difficult to understand in this aspect, but nevertheless it could be seen. So we use this designation, musculus semitendinosus. And now let's continue on posterior surface of the thigh. Here it is, posterior surface of the thigh. We already have shown the most superior part of it here in gluteal region, and now the whole thigh and part of leg. So number 1 is gluteus maximus, number 2 is gluteus medius, number 3 we know that it's vastus, it's mistake, vastus lateralis. Number 3 is vastus lateralis. Please make correction. Number 4 is musculus gracilis. Number 5 is musculus adductor magnus. And now, please be quite attentive. Number 6, it's muscle which named musculus semitendinosus. Why this name? Because it has quite long tendon, so long that it is 1/2 of length of this muscle. So musculus which have a long tendon, 1/2 of its length, that in translation from English to Latin will be semitendinosus. So number 6, semitendinosus, can we from the first side to distinguish where is lateral surface and where is medial? Sure, this is lateral and this is medial. So musculus semitendinosus on posterior surface of the thigh is always oriented medially, and close to it from lateral side we can find number 7. Number 7 is musculus biceps femoris, caput longum musculus biceps femoris. So if we can watch the most inferior part of this picture, we can find a popliteal fossa, fossa poplitea, which has rhomboid shape, and this superior part of the rhomb is arranged by musculus semitendinosus from medial side and biceps femoris from lateral side. And then number 8 from both sides, they are musculus gastrocnemius. They have two heads, caput longum, caput laterale et caput mediale. Musculi gastrocnemius caput laterale et caput mediale. This is mistake, please correct it. Laterale, it should be written. So, popliteal fossa is limited by 3 muscles: musculus semitendinosus, musculus biceps femoris, and musculus gastrocnemius, which has two heads, caput laterale and caput mediale. And very small but interesting muscle number 9. What is it? It's musculus plantaris. Musculus plantaris is similar to musculus palmaris longus in the forearm, so we can compare them. So with this picture we have finished, and now muscles of anterior surface of the thigh. Here it is, this picture. I should declare that all these pictures are from Gray's Anatomy, of textbooks of Gray's Anatomy. So let's begin from the superior part of our picture. Number 1 is musculus iliacus and number 2 is musculus psoas major. And then they connect together and become musculus iliopsoas. Musculus iliopsoas. Here it is, musculus iliopsoas. What is this? It's ligamentum inguinale. We can say ligamentum inguinale is a border between abdomen and between thigh. So, in abdomen, there are two separate muscles, iliacus and psoas major, and in the thigh we can find that they connected together in single muscle, musculus iliopsoas. Here it is. Then iliopsoas in left part of our picture was cutted and removed in this place. Here it is. Then number 4 in the left part of our picture is musculus rectus femoris. We can see that it originates from spina iliaca anterior inferior. Here it is. This is spina iliaca anterior superior and this is spina iliaca anterior inferior. So musculus rectus femoris originates from this point. And then number 5 in right part of our picture, which is different from left part due to musculus rectus was cutted and removed. Here we cutted musculus rectus femoris, and more deep under it we can find this number 5, musculus vastus intermedius. What does it mean, term vastus? In translation it means wide muscle. So musculus vastus intermedius. Why intermedius? Because also we can find vastus medialis and vastus lateralis. That's why. And now number 6. What is number 6? It's musculus sartorius. We can say that in our picture musculus sartorius was cutted and removed in 2 places, in middle part of thigh and here close to its origin. And musculus sartorius, we can say, is most long muscle in our body, in our organism. Most long. In translation, it means Taylor's muscle. Taylor's muscle. And then we shall demonstrate number 7, musculus vastus medialis, and number 8, here it is number 8, musculus vastus lateralis. We already have discussed that musculus vastus lateralis could be seen not only from anterior aspect, but also from lateral aspect and from posterior aspect. So it's really wide muscle. Vastus means wide. Then number 9. Here it is, number 9. What is it? It's musculus obturatorius externus. It closes foramen obturatorium from anterior surface, from externum, and that's why obturatorius externus. Number 9 is musculus obturatorius externus. So we have finished with this picture, and now another picture. Medial group of muscles of the thigh, medial group. To obtain such specimen, what should be done? We should cut and remove all superficial muscles. So, quadriceps femoris was cut and removed, iliopsoas was cut and removed, and so on. So now we can see only medial group of thigh. And first muscle is this musculus pectineus. We shall ask ourselves about the terms. Why pectineus? Because it originates from pecten ossis pubis. That's why pectineus muscle. And sure, as a result of contraction of this muscle, we can have adduction of thigh. Adduction of thigh. And number 2, what is this? Musculus adductor brevis. Musculus adductor brevis. Adductor brevis. Here it is. First of all, let's discuss what is the difference between these two pictures. Left picture has more superficially located muscles. So in right picture, musculus pectineus is absent. It was removed. And that's why musculus adductor brevis in left picture we can find only partially. And on the right picture as a whole. So musculus adductor brevis. As in the name, we can understand the function to adduct the thigh, and according to direction of fibers. As a result of contraction, we can find the movement to medial plane. So adductio. Adductio. Then number 3. We can see it only in left picture. Why? Because it is located more superficially. Number 3 is musculus adductor longus. So if we try to find them in the cadaveric specimen. So musculus adductor longus is more superficial, localized in comparison with adductor brevis. Adductor brevis is more superiorly and more deep localized. So adductor longus number 3. Then number 4, adductor magnus. Number 4, adductor magnus. Quite large muscle. Please pay attention that we can find it both in anterior surface and also when we return the cadaveric specimen. When we turn cadaveric specimen to the back, we can find it from back surface. So adductor magnus is very large muscle. And be attentive also to this opening, which connects anterior surface and posterior surface. What is it? It's so named hiatus adductorius, very important connection through which arteria femoralis pass to popliteal fossa and become not femoral but popliteal artery. And now number 5, only in left picture because it's superficially located, it's musculus gracilis. Musculus gracilis. Musculus gracilis. And number 6, here it is, number 6, only in deep part of our specimen. Number 6, it's obturatorius externus. It's clear that it is located from external surface. And to find it in cadaveric specimen, what should we do? We should try to watch under or deeply to this number 1, musculus pectineus, and number 3, adductor longus. So if we try to see under it, we shall find musculus obturatorius externus, number 6. And now, very interesting question. The femoral triangle. Here it is, with violet color designated. And this triangle shape part of superior thigh is limited by 3 structures. Number 1, what is it? It's ligamentum inguinale. We can say that ligamentum inguinale is the border between abdomen and thigh. And if we are looking, if we are investigating, exams the living person, where can we find the border between the abdomen and thigh? It will be not ligamentum inguinale, but plica inguinale. Plica inguinale, inguinal fold, is a border between the abdomen and thigh. And by the mean, the author's name of ligamentum inguinale is ligamentum pupparti. Pupparti. Ligament of Puppart. Number 2, what is it? it's musculus sartorius. And number 3 is musculus gracilis. So here they are the borders of femoral triangle. And what muscles are located in this triangle? First of all, number 4, what is it? It's musculus iliopsoas. It should be written as one word, iliopsoas. Then, number 5, what is it? It's musculus pectineus. And then number 6, it's musculus adductor longus. So, now we know the muscles which are located inside of femoral triangle. And let's remember another muscles in this picture. Number 7, what is it? It's musculus iliacus. Number 8, what is it? Musculus psoas major. Here it is. And number 9, here it is. What is it? It's musculus obturatorius internus. So, then musculus rectus femoris, number 9, and musculus vastus lateralis, number 11. And now, why we need to know this? To understand the content of femoral triangle. What can we find here? The vascular and neural bundle, which contains from nervus femoralis, here it is, of yellow color, arteria femoralis of red color, and vena femoralis of blue color. And according to another designation here, let's compare these two pictures. Number 12 is musculus tensor fasciae latae. Tensor fasciae latae. By the mean, all these green dots demonstrates us lymph nodes, special small organs of immune and lymphatic system, which are in numerous quantity in pelvic region and in upper thigh. And now let's again return to posterior muscles of thigh in this picture. What we can find here? Number 1 is musculus semitendinosus, number 2 is musculus biceps caput longum, number 3 is musculus biceps caput breve, and what is this number 4? Sure, it's musculus adductor magnus. Adductor magnus is quite large muscle. Here it is adductor magnus, and here it is, it's also. So all this two muscles, number 1 and number 2, biceps and semitendinosus, they lies on the adductor magnus. So adductor magnus could be seen from posterior view if we try to pull the semitendinosus and musculus biceps femoris. Then number 5, what is it? Number 5. It's musculus quadratus femoris. And more superiorly to it, number 6, we can find two gemellis, musculi gemelli, superior and inferior. Between it, we could find the tendon of musculus obturatorius internus, but you can see that foramen obturatorium is opened here. That means both obturator muscles were cut and removed. That's why gemelli are without third tendon, without tendon of musculus obturatorius internus. And now another picture in which all these muscles were cut and removed. So also musculus number 1 semitendinosus were also cut and removed. And that's why more deep according to it we can find muscle number 7. Here it is. What is it? Next layer under musculus semitendinosus. It's musculus semimembranosus. Number 1, it's mistake. We should correct. It should be number 7, semimembranosus. Musculus semimembranosus. Why such name? Semimembranosus. In translation, it means muscle which have half of its length formed by tendon, and this tendon is wide and thin as membrane. So one half of this muscle is membrane, but this membrane in comparison of semitendinosus is superiorly located. Tendon of musculus semitendinosus here inferiorly, but tendon membrane of musculus semimembranosus is located superiorly. So, and now muscles of thigh and leg from posterior surface. Muscles of thigh we already know. Number 1 is musculus biceps femoris, caput longum. Number 1 and dot biceps femoris, caput breve. Number 2 is musculus vastus lateralis. Number 3 is musculus semitendinosus. Number 4, more deeply located, is musculus semimembranosus. And number 5, here it is musculus gracilis. So, all these muscles we already know. And more inferiorly we can find musculus gastrocnemius with 2 heads, caput mediale and caput laterale. These 2 heads connects with each other in very popular, according to the Greek myths, tendon which named as Achilles tendon, or musculus, tendon of musculus triceps surae, Achilles tendon. Why this name. You know the Greek hero Achilles, when there was a war between Greek and Troya. He was a hero which was practically unbreakable, and only one part of his body was able to be destroyed, to be breaked. This was this tendon. And exactly in this place, his enemy has damaged him, and he was died. And for each of us, even if we are not heroes, this tendon is very unsaved place. So each trauma of this tendon could lead the inability to move, because we are standing upright, also due to using this large tendon. So Achilles tendon, or tendon of musculus transeptus surae. Then this arrow, number 8, what is it? It's muscle which is lying more deeply under musculus gastrocnemius. It named musculus soleus. Musculus soleus. And now be attentive. What is it? This next arrow, number 9, what is it? This arrow number 9 means musculus peroneus or fibularis. It's synonyms. Peroneus longus. Let's try to count toes. First toe or great toe, second and fifth or little toe. So if this is fifth toe, it means this is lateral malleolus. Malleolus lateralis. And musculus number 9, musculus peroneus longus, passes posteriorly to malleolus lateralis, and then it goes transversely through the foot and attaches here on the first metatarsal bone. So, peroneus longus is the muscle which tendon cross up the foot, the plantar part of the foot, and attaches to the first metatarsal bone. And now let's try to distinguish these muscles which are localized close to medial malleolus. This is malleolus lateralis because this is fifth toe, and this is malleolus medialis because this is first toe. So we can find here, first of all, number 10. We are counting from medial position. Number 10 is most medial tendon. It's musculus tibialis posterior, which attaches to os naviculare. Here it is. It's attachment to os naviculare. musculus tibialis posterior. Then, more laterally, next tendon, number 11, what is it? It's musculus flexor digitorum. And then, number 12 is musculus flexor hallucis longus. Is musculus flexor hallucis longus. And for compare in another picture, I use the same designation to have possibility to understand most important thing. These three tendons are arranged in such kind of sequence or order. Tibialis posterior, then flexor digitorum, then flexor hallucis longus. It's difficult on the cadaveric specimen to distinguish muscles. It's easier to distinguish these tendons. And for this distinguishing, it's better to remember this order, this consequence. Musculus tibialis posterior, then musculus flexor digitorum, and then musculus flexor hallucis longus. So knowing this sequence, we can distinguish them from each other. And now number 13. Here it is, number 13. It's musculus plantaris, which is rudimentary muscle, and we already have said that it's similar to musculus palmaris longus in the forearm. And now let's try to distinguish from anterior surface of the muscles. Practically, we already know here all muscles except three. Let's remember the main structures, main muscles. Number one, what is it? It's musculus quadriceps femoris, exactly tendo of musculus quadriceps femoris. Then number two is musculus vastus medialis, here it is. Then number three is vastus lateralis, here it is. Then number four, tractus iliotibialis, because it's lateral side. Be attentive to the toes. This is fifth toe, so this is tractus iliotibialis. Then, number five is musculus sartorius. Here it is, musculus sartorius, from medial side. Then, number six is ligamentum patella. We know this ligament from September, from the beginning of our education, because when we studied knee joint, we already learned this ligament, ligamentum patella, which is attached to tuberositas tibia here. And then number seven is musculus gastrocnemius caput mediale. Mediale because here it is first toe. Gastrocnemius caput mediale. And then number eight, musculus soleus. It's interesting, we can distinguish from anteriorly sometimes, if person is quite muscular, these two muscles. It's interesting because they are muscles of posterior surface. And then number nine, musculus peroneus or fibularis longus. we can find that its tendon passes posterior to lateral malleolus. And number 10 with this arrow, it's musculus peroneus or fibularis brevis. So if we compare peroneus longus and peroneus brevis, we can find that peroneus brevis is more deeply localized. Peroneus brevis lying more deep layer than peroneus brevis. Now, it's three muscles which we before not learned. Here they are. This is three muscles of anterior group. Number 11, what is it? It's musculus tibialis anterior. We can prolongate it into its tendon and find the place of attachment. First cuneiform bone and navicular bone. And then number 12 is musculus extensor hallucis longus. Here it is, extensor hallucis longus. Be attentive. Now we are looking for the tendons. It's easier than distinguish the muscular part of each muscle. Tendons is more clearly demonstrated here. So number 12, extensor hallucis longus. And then number 13, here it is, number 13, it's musculus extensor digitorum longus. So now I use this red square. For what purpose? For remembering the order, the consequence of positioning its tendons. So be attentive. Extensor, first muscle, musculus tibialis anterior, then extensor hallucis longus, number 12, then extensor digitorum. This order, tibialis anterior, extensor hallucis, extensor digitorum. And please remember the order on the posterior group. Here it is, tibialis posterior, flexor digitorum, and flexor hallucis. It's easy to forget, but how we can help ourselves to not forget that in this order, changing only one position, anteriorly we can easily distinguish extensor hallucis longus because its tendon quite good seen. But we should know that from posterior group, flexor hallucis longus is third in this order, third in this consequence. So for us it could be easy to compare them. Anteriorly, tibialis anterior, extensor hallucis, extensor digitorum. Posteriorly, tibialis posterior, the same practically, in order. Then flexor digitorum, number 2. And number 3, flexor hallucis longus. And two very interesting details. What is it? We already said that on this thigh there is fascia lata, which surrounds all thigh from around. And on the leg there is also fascia cruris, which has two thickened parts, which is demonstrated here. Number 14 is so named retinaculum extensorum superior. Through it pass these 3 tendons: tibialis anterior, extensor hallucis longus, extensor digitorum longus. And number 15 is retinaculum extensorum inferior. So all 3 tendons passed through both to these retinaculi. We used this material in 2 aims. One of them, to be good controlled by the testing, using all these pictures with number designation. It's easy to control. You can prepare yourself and we can control you. And second aim was to compare these schemes with cadaveric specimen. When we know the real positioning of each muscle, each tendon, it's easy for us to find it in the cadaveric specimen. So the good mark during exam will be if we both can know each muscle in the pictures and also to distinguish them in the cadaveric specimen. Thank you for attention.